Across the country, COVID-19 is surging as the highly contagious Delta variant continues to spread. According to data from the Centers for Disease Control, 63% of Americans 12 and up are fully vaccinated, and nearly 74% have received at least one dose. But the CDC director, Rochelle Walensky, says well over 90% of people who are in the hospital are unvaccinated, and that includes children. In the last 2 weeks alone, nearly 500,000 kids tested positive for COVID-19, according to the American Academy of Pediatrics. ABC News medical contributor Dr. Darian Sutton is here with more on this. Dr. Sutton, thanks so much for being here. It's great to have you, especially here in the studio. So what do you make of this rise in pediatric cases? What brought us here, and how do we bring it down?
This is something that's to be expected, sadly, especially in the setting of the more transmissible Delta variant. It is targeting those who are unvaccinated, which unfortunately are children, especially those under the age of 12 who are not vaccinated. Ways that we can mitigate or decrease the risk of transmission includes very basic steps, which is vaccinating everyone around these children and using mitigation efforts when these children are in close contact with each other. And that includes ventilation, spacing when possible, masking, and all of these efforts combined. And I really believe that they can truly decrease the rates of COVID-19.
Now, a school district in North Carolina just decided to ditch most of the quarantine protocols and contact tracing. They now say that students and teachers and other staff members only have to isolate if they themselves have tested positive or if they have symptoms. So how effective is that compared to the normal quarantine protocols of, for example, quarantining if you've had close contact with somebody else who tested positive, regardless of whether or not you are showing symptoms or have tested positive yet?
I do not think that this is a safe plan. Unfortunately, I have seen how this plays out, and many of these people end up in the emergency room with me as their physician. So we contact trace to identify those who might be infectious or at risk of getting an infection, and we quarantine those to isolate those who might be infectious. And it's important to understand that those who are infected with COVID-19 are most infectious 2 to 3 days before they develop symptoms. So that allows for a lot of unwanted transmission to go on. So if we want to keep kids in school and keep outbreaks low, it's really important to use these mitigation efforts combined with masking and vaccination to make sure that we keep kids safe and keep schools open.
And now we often hear about the schools that are dealing with big outbreaks, but are there schools where you're seeing success stories that you think are doing this especially well and can serve as a good model to keep kids in school and keep them safe?
Absolutely. Actually, last week, San Francisco Department of Health just released information regarding their outbreaks. And what they found was that in their public school district, which has 90% of those who are aged 12 to 17 who are vaccinated, they had 0 outbreaks. So it just goes to show that basic mitigation efforts, including vaccinations, can really decrease the risk of transmission and keep kids out of the hospital.
And I want to shift away from kids in schools for a second, because a new study conducted in the UK now says that vaccinated people who experience breakthrough cases are less likely to have long hauler symptoms. How important is that finding?
Yeah. So I've been experiencing this with a lot of patients who are coming in with long haul syndrome. And basically the way that we identify it is patients often have symptoms of COVID-19 with 1 to 2 weeks duration. Some of those patients, unfortunately, approximately 33%, go on to develop some type of a long-term symptom. And that can include mental fogginess, headaches, fatigue, shortness of breath, palpitations, and that can last for 4 weeks or longer beyond the initial infection. What this study found was that those who were vaccinated had almost half the rate of long-haul syndrome. And so it really shows that it could be effective in helping a lot of patients who feel unheard.
All right, Dr. Darian Sutton, it's always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.